And we begin the program with New York senior senator and a member of the Finance Committee, Chuck Schumer. Senator, thank you for being with us. The CBO dealt with what some said was a devastating blow to the Democrats' health care initiative, saying that costs would rise, federal debt would increase, necessary fundamental reforms wouldn't be made. How can you fix that?
Well, first, we in the Senate are coming up with a bill that's very focused on cost cutting. The goal, which I think we'll achieve, is to have the new revenues we need more come from cost cutting than any kinds of increases of fees or taxes or whatever. But second, in all fairness to the House and to the Health Committee, CBO's scoring is a little bit wacky. In other words, we know that diabetes is a scourge. And we know, for instance, right now, that there is no payment by Medicare, Medicaid, or health insurance for early intervention, which can cure diabetes cheaply in the early days. Diet and exercise. Of course, they'll pay, God forbid, when diabetes in later stage to amputate your leg. We want to put in money for the early intervention. CBO says that's a cost.
So
they give us no credit for all the reductions 5, 10, 15 years down the road of less dialysis, fewer amputations, fewer eye operations.
So it may not cost out totally for CBO, but
Correct.
It still may be something
but
you would find.
Look, CBO, even though they are not quite fair, because they don't measure the cost savings down the road, just the immediate spending, we're going to have to live by them, and so we're going to have to be tougher on costs, and I think in the Senate we will be.
They said, the director said, that one of the things that you should do to hold down cost is tax employer-paid health benefits, or at least the Cadillac portion of it. In order to get a bill, would you, and do you think the president accept something along those lines?
Well, I don't. The president's strongly against it, and he said that publicly. I think the majority of Democrats and most Republicans are against it as well, and here's why, Al. Because to really get revenues out of that, you need to go deeply down into the middle class. Yeah, for instance, there are firemen, for instance, who bargained and said, only pay me $40,000, $50,000 a year, but make sure I have a Cadillac health care plan because of my job and everything else. And so they got a health care plan that's worth $20,000. To then say to that family making $50,000, you got to pay $2,000, $3,000 in taxes, when someone else who has a low health care plan makes $125,000. Not fair.
So that CBO recommendation just is not.
I just don't think it can fly, because it's. And you could sort of do it at such a high end that it wouldn't affect that firefighter. Then you don't raise any money.
Do you think, with the failure of the Senate Finance Committee to come up with a bipartisan bill this week at least, is there any case for taking the Kennedy-Dodd bill to the floor and just amending it?
Well, I think that Senator Baucus, boy, I take my hat off to him. I've never seen anyone work so hard and diligently and unflappably through this. He met with some of the leading Republicans for about 8 hours yesterday. They came closer. He thinks it's possible we can have a bill Tuesday or Wednesday. So we're sticking with the program. And my belief is that if we can't come to a bipartisan agreement, the Finance Committee will report out a Democratic bill. But our preference, far and away, is for a bipartisan bill.
One Republican that you seem to have a chance to get in the Senate, there aren't very many, is Olympia Snowe of Maine.
She's a great lady.
She met with the president this week, and afterwards she said the president should be patient. It would be prudent for him to be patient. No deadlines. Do you think that the Obama August deadline should be moved back now?
Okay, well, first, Olympia Snowe is somebody not only I respect, I don't matter, but the president really respects her a whole lot. I know that. I think working under a deadline on something difficult helps get something done. And we've spent a lot of time on this. It's not that we started 2 weeks ago. We started 3, 4 months ago. So I think having the deadlines is very, very important, and I think we should strive to meet them. I think we can meet them and meet Olympia's concerns.
Would it be a disaster for the bill if the August deadline's not met?
I don't want to even speculate. We got to stick and try to get this done. We're not going to finish it. It's not going to be signed into law, but to have the House and Senate each pass bills before we go into August break, I think is a worthy goal. It helps get the bill passed, and we ought to stick with it.
You proposed this week to slap $100 billion in new fees on the health insurance industry to help pay for health care costs. How do you prevent them from just passing it on and skyrocketing premiums and adding the cost?
It's a great question, but that is something we are looking at. There are ways to do it to prevent the costs. 2 ways. One is just the way it's structured. The second is to create competition. Here's a fact that your business people would be interested in for different reasons. In 2000, the top 10 health insurance companies made profits of $2 billion. In 2007, it's $12 billion. It's greater increase than oil, than anything else. It's because it's a highly concentrated industry. In 94% of all markets, the Justice Department says it's highly concentrated. So getting more competition will also help.
Will that be
here.
enough to prevent them from just passing it through?
Well, competition changes the elasticity of the cost curve, but no, we're going to have to come up with mechanisms in the bill to prevent it if we're going to do that. And that's what we're working on, and we think it's doable.
A couple financial questions. Do you agree with the Obama administration's decision not to extend financial assistance to CIT?
I think it's a tough question. I don't know the details inside, so I couldn't say yes or no. But look, let's face it, CIT is hardly blameless. They had a great business. You know, they funded lots of small businesses, made a profit, and then sometime in, I guess, 2004, 2005, started going into subprimes like everyone else. Here's the key to me. It's not whether CIT goes under or not. It's that somehow the administration, I'm communicating this to them, creates a lifeline for the thousands of small businesses that are blameless and depend on CIT.
That's more important than CIT.
That's more important than CIT itself.
Should Ben Bernanke be reappointed?
Look, I think Bernanke's done a very good job. I'm not going to handicap would he be better or worse than somebody else. But to me, at least, watching him up close, he's steady, he's calm, he's knowledgeable, and I think he has, despite these recent hearings on one issue, he has the confidence of the economic community. So I like him, but I'm not going to handicap whether he'd be better than someone else.
But you wouldn't be displeased if he were reappointed?
Well, I would say that he's done a good job, so yeah, I guess that's right.
All right, I'll get you to handicap one thing. You said this week that Judge Sonia Sotomayor would probably get about as many votes as John Roberts got, 78. All right, you're now Las Vegas Schumer. Over and under 78, more or less than 78?
I'd say it's about at that level. I think she did a great job in the hearings. I think that they threw a lot of hard questions at her, to which they're entitled. I think my Republican colleagues were tough but fair, but man, did she stand up well. And I think as the American people watched her, as the polling data shows, they liked her very much. And I think there are lots of Republicans who don't agree with her specifically on one issue or another are going to say, maybe we should vote for her. So I'd say it's about 78.
About 78. Thank you for being with us, Senator. When we